finally, we got to choose the places to disinfect. We got a product. We got sort of a process. Now we need to match that with a place or a thing. Any of you familiar with GlowDraw? It's this awesome product, $15. Comes in a powder form, which is kind of like dander, or it comes in a liquid form, which is kind of like snot. And you can order it. You can have all kinds of fun with this. And so this is what we did. We spiked a little white dog with it. And we let it go through its life at a really nice veterinary clinic just to show, what are the surfaces that get contaminated. Like, we know about the front of hands, and what I've found is I'm very good at cleaning the palms of my hands. I do it every time. But I'm not so good at cleaning the backs of my hands. We forget about our forearms, our face, our clothing. This is after another exam. Where has it spread to, even though the person did wash hands between exams? The clipboard, that's common, popular, fomite. The legs of the exam table, so we clean the exam surface, but really dogs have contact with things that are down, at dog height. So think about what populations are most vulnerable. It's your new intakes and your juvenile animals. And really, you can use GlowDraw. It's non-toxic, it's fun. Or you can just do a mental inventory, like, wow, let's watch 10 animals. What surface do they touch? And what do they touch most closely? Where are we going to see the highest dose? And instead of worrying about cleaning their cages every day, what's going to be our strategy to decontaminate those most important places? So this is just an example. And I worked at a shelter for like 6 months before I got wind of the fact that there was no place for the animal control officers to clean their vehicles in the winter. So we were cleaning the hell out of the shelter and locking it down every time we had a case of parvovirus. But meanwhile, the animal control vehicle unit wasn't being decontaminated. So if you're having a problem with continued spread of an infectious disease and you think you're 10 minutes, I think I'm all right. You think your process is good and your product is good, start to look outside of the animal housing areas. Take a look inside the compartment of an animal control vehicle. Or if you're working with rescue, check out, are people cleaning their crates? Are they letting dogs romp around in the backseat of their car during transport? Is there an issue with clothing? Are get acquainted rooms serving as a common place for animals all to pass through? So we really want to focus on high contact surfaces, including high contact humans. And for instance, we had an outbreak at our local shelter of necrotizing Streptococcus catus. And it was causing abscesses to break out all over the cats. And I don't know if it was coincidence, but it went away when the main vet tech went on vacation. Those are people who are responsible for a lot of animal contact. And so they might be doing intake and holding animals when they're first fresh in the door at their very most vulnerable. They might be treating sick animals. They might be assisting with surgery. They might be performing behavior evaluations. They might be performing euthanasia, including euthanasia of the sickest animals. And they might not be changing their clothing in between all of those encounters. So identify your high contact humans, acknowledge if it's you, and try to divide your activities up during the day. You can't change clothing between every animal, but arrange your day so that you can put on a clean top at least before you do intake. Or put on protective gear while you're treating sick animals or while you're performing euthanasia, and take that off when you go to assist with spay-neuter surgery, or you move to another area of the shelter. And think about, if all you can do is have a protective jacket, a surgery gown, or a scrub top, or whatever hanging in an isolation room that everybody puts on and every sick cat or sick dog contacts it, that's still better than having it leave that room. So think about ways that you can control high contact humans. And then really focus on cleaning animal housing between occupants. while an animal is occupying a space, it needs to be cleaned on a daily basis so that it looks good and it smells good and the animal's not sitting in pee. It does not need to be disinfected daily. And this is just to put things in a little perspective. We kind of hate this at shelters, right? When people poke the cats, they pet the cats. Why do they do that? I do it myself, and I've been doing this for 21 years. Still, I pet the cats, and then I pet them with one end of my ballpoint pen, and then I pet them with the other end of my ballpoint pen, and then I pet them with my left hand. So we got this device, and we actually measured how many germs were on 4 centimeters of someone's hand after they petted 3 cats through the cage bars. And then we measured the germs on 4 centimeters of somebody's scrub top when they were halfway through morning cleaning in just typical cat housing where they had to. I mean, I didn't pose this picture. This is an enormous cat, and she just had to take her out of the cage in order to clean the cage. On the person's hand, there was about 67,000 units of contamination versus 2.4 million units of contamination on the scrub top. So if you can bypass one contact with a contaminated scrub top, you can pet approximately 54 cats with the same dose. And which is going to help more cats have a good experience while they're in the shelter and get out the door alive? Let people pet the cats. The single most important source of shelter cat disease, what is it? People? Stress. It's stress. It's not even disease transmission. A lot of cats walk into shelters pre-equipped with feline herpes virus, which causes upper respiratory infection. And so even if we never touch them, but we just scare them, a lot of them are going to get sick. So with cats especially, we have to handle them with kid gloves and recognize that by aggressively disinfecting, we can be doing more harm than good. So how many of you are already using spot cleaning? Are any of you working at a shelter where you're not using spot cleaning? Okay. To the extent possible, and sometimes, especially with really small housing, it's not possible, but to the extent possible, we don't need to use chemicals, just a plain cleaner on a day-to-day basis, and just tidy the cage, and if you can possibly leave the cat in its environment, it's easier for you, it's easier for the cat, and it can actually reduce feline disease. And this is something to just be aware of. When we track noise over time in animal housing environments, cleaning time is by far the noisiest time. And you can actually see animals that are sort of starting to fall asleep and then a cage door bangs and they wake up. And so just being cognizant of opening and closing cage doors quietly, especially in feline housing areas, can be really an important factor. What do you think matters most? I know I have like -1 minute, huh? Or do I have 4 minutes? Woohoo! What matters most? Hands, clothes, feet. Well, I don't know. You know, when we looked at that 4 centimeters piece of a scrub top, wow, it really looked like clothes. And I think that's partly because it's just easy for hair and stuff to collect on clothes. It's a surface that's conducive for it, and we put a lot of acreage of an animal up against our clothes. You know, more of their body surface contacts our clothing, and then they lick whatever is off on our clothing, off of their fur afterwards. But this also looked at just how much doctors transmit disease on their white coats, and it turns out white coats are incredibly unsanitary. So I think I talked about that sufficiently. I think the single most important thing we can do to make cleaning less hazardous is if you can't change clothes any other time, put on protective gear when you're cleaning, take it off, and go on about your day. This is from our Facebook page quiz. Which was more effective at reducing bacterial count on vet students' hands? Correct hand washing or correct hand sanitizing? How many say B? 2. Are you our Facebook followers, or are you just people who know, like, why would I ask that? It's B. Hand sanitizing was more effective at reducing bacterial count. Now, hand sanitizers don't kill parvo, panleuk, or ringworm, but in terms of protecting human health from petting a cat and then picking their nose, the best thing you can do for that person is make sure that there's a hand sanitizer in every animal housing area. I know. This is from a Japanese shelter that makes it look incredibly fun to wash your hands. But just make sure that the recommendation is hand sanitizers within 3 feet of point of care or in every animal housing area and convenient to every exam surface. 20 to 30 seconds contact time, all surfaces of the hands. And then hand washing for you, shelter workers, before and after handling sick animals, before and after handling juvenile animals, before and after moving between different areas and activities, and anytime you know you've handled an animal with something serious. And gloves if you're handling something like known ringworm or known panleukopenia or parvo. Type hand sanitation into YouTube. It's hours of fun. I don't have time to go over it. And finally, what type of foot bath was most effective? Quaternary ammonium, bleach, which is sodium hypochlorite, potassium peroxymonosulfate, or none of the above. All were equally ineffective, and we can forget about foot baths. A and D. D. Sodium and bleach and quats didn't even work to reduce bacteria on boots. In a correctly used foot bath, which was freshly made up and completely covered all the treads of the shoe with scrubbing. Trifectant actually reduced bacterial count on shoes, but it had no effect on the bacterial count on the floor surface after the foot bath. So the bottom line is, if you're using a product that's ineffective, you're just moistening the shoe and facilitating its success as a fomite in your environment. And even if you're using an effective disinfectant, you may be facilitating some tracking. So it's a waste of time, basically. Yay. So don't worry about foot baths. If you've got something serious where you really can't be having it tracked all over creation, then you need to get dedicated shoes or shoe covers to use in that environment. You don't need to do that except in areas where you're treating something like ringworm, parvo, panleukopenia. That's highly, highly contagious. The truth is you can get away without foot baths. The good news is they weren't doing anything, so getting rid of them is not going to make it worse.